We are going low. How low are we going? We're going to below the skirt. Hi, my name is Tamara, and I am a pelvic physical therapist, and I help women overcome uncontrolled bladders, return to pleasurable sex, and manage pregnancy symptoms so you can become a postpartum champion. And I never get started without my girl Virginia. She's always here to be my partner in crime. So how do abdominal surgeries affect below the skirt? It all depends on how high you wear your skirt or how low you wear your skirt. But if you wear your skirt high, it can take in that area. So if you picture using Virginia here, from the pelvic bone here, and then going up to your abdominal area, that's a wide range. It's a very wide range. Now, when you have abdominal surgery, it depends. There's many different surgeries that you can have. You can have a C-section. You can have an appendectomy, which is removing of the appendix. You can have a hernia repair. There's so many different ways or different surgeries that you can have that requires that type of work. So you may say, okay, well, what does that do? How does that relate to below the skirt? That is a great question. Because anytime you are going into your abdominal cavity, for whatever reason your procedure is done, you are changing the integrity of the skin, the muscle, the fascia, all of those different supporting those structures that hold the organs in place. Now, how does that affect below the skirt? Well, it's very common if you've had multiple surgeries before, for whatever reason you've had them, you may say, I just don't feel strong. My core feels weak. I feel like ever since I've had all these surgeries, I've noticed I've had some incontinence, urinary incontinence. Or you may be having some fecal incontinence, which you may notice some streaks in your underwear maybe after you've thoroughly cleaned. You may also feel like I've been having some constipation since I've had these abdominal surgeries. And these are common things that occur. So every time you have some type of abdominal surgery, you are increasing your likelihood, or you can have effects of having these problems. So it is not uncommon. It's common, but is it normal? It isn't. Now, many women have described to me when they've come into the office as to after they've had multiple surgeries on their abdomen region, what happens, they say, I just feel like my tummy feels like it's pudding. It's just mushy, gushy, it is just there. So you realize when you're having these surgeries, you're having scar tissue. Scar tissue is being built through this every time that they're cutting in. So it changes the integrity of how things move. So you can have enough scar tissue that builds up enough to attach onto your bladder. Well, attaching onto your bladder can increase, I'm not saying it always will, it can increase you having that sense of urgency, wanting to urinate. Or you may feel like you're not able to fully empty. Or you may feel like you are you may be leaking. Well, you're leaking because if the core has been cut in two, and remember that core covers a big area, if it's not having the flexibility and the coordination and the strength to do what it needs to do, then it's not moving. It's like motion. Motion is lotion. If it's not having that fluid motion to function the way that it really needs to, then you can have some other issues. So having a weak core can make a domino effect of the weak pelvic floor, or vice versa. So these are very common concerns or different issues that women have coming into the office when they've noticed that they've had abdominal surgery. And anytime I go through an assessment, what do I ask? How many surgeries have you had? Have you had any abdominal surgeries? Those are the beginning questions that need to be asked. And if you say, yes, I've had 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, women have so many ranges of surgery. And if you say, I have had these surgeries, and you're noticing you're having issues with constipation, or you are having issues with urinary incontinence, or you're having like low back pain because the core is really weak, just realize, take yourself back to the past. You may want to plant yourself there and say, you know what, I've had multiple abdominal surgeries, and this could be the possible reason as to why I'm having these below the skirt issues. And yes, you've had these surgeries for the different reasons that you have had. But again, you just have to peel everything back. Peel that onion back one layer at a time. Because it didn't take you one day to get here. It took you multiple surgeries to get here. And if it took you multiple surgeries, it will take some time. But if you do the work, get the help that you need, you can go to a physical therapist in your area. Or if you're in the South Carolina, Charleston, Summerville vicinity, I'm here to assist you. Realize these things can help. And you may say, okay, what can I do about it? What are some things that you do in the office that will help with my issues? Again, you come in, you tell me what your problem is. You're not going to say, hey, I am this. You're going to say, you know what, I can't control my bladder. So we tackle that. It may be you working on some stretching, showing you stretching regimens that you need to do, working on strengthening, working on behavioral management. Because some of the issues that we're having, yes, it's because of the deficits that you may have, but it may be some things, some habits that you brought on to exacerbate what your symptoms truly are. So those are just a few of the things that we do in the office. But the biggest thing is, I am helping you try to get there. Trying to not allow your below the skirt issues to take over above the skirt matters. And I talked to a client recently, and she was explaining how the constipation is so severe. So severe, but mind you, she's had multiple surgeries. So that was a component of where we had to start, pull that onion back at that layer to work there. Her issue was constipation coming to the office. And now she's currently not on Miralax or using any suppository to help her have a fluid bowel movement. So I just want to let you know these are some of the things that you can have, and you are not alone. You are not alone. It is common, but it's not normal. But there is help. And the first thing you need to do is just recognize you have that issue. And if you do, go to your doctor. Let your primary care physician know. Let your OBGYN know. Let your provider know, your urologist or your GI doctor. Let them know and say, you know, hey, I want to try a conservative method. And that method is pelvic physical therapy. You just let them know. So hopefully I'm giving you some ideas as to why, or have brought you into the scope of knowing, you know what, hey, some of these issues that I'm having is not because it's just me or I may be getting older. It could be because possibly of you having multiple abdominal surgeries. So these are your tools I put in your toolbox for today. So I don't want you to live in silence, but I actually want you to live out loud. So I want you to go and live your best life below the skirt. And if you are having some problem of some sort, take action and be an advocate for yourself. And I hope you continue to live your best life below the skirt.